Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Fluvastatin. Its brand name is Lescol. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So Fluvastatin is a cholesterol-lowering agent which competitively inhibits HMG-CoA reductase. This prevents the conversion of HMG-CoA to mevalonate to produce cholesterol. In terms of indications for use, this medication is indicated to be used in the treatment of coronary arteriosclerosis. It can be used in the treatment of familial hypercholesterolemia, as well as in the treatment of mixed hyperlipidemia. Now, before somebody was to use Fluvastatin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to Fluvastatin or any other component of the formulation, they would not be able to use this medication. Patients with active liver disease should not use Fluvastatin. This medication will be contraindicated in pregnancy or in nursing mothers. And finally, this medication will be contraindicated in patients who have unexplained or persistent serum transaminase elevations. Now, in terms of precautions, it should be noted that patients greater than the age of 65 may be at an increased risk of experiencing myopathy. If somebody is using Fluvastatin and they're also heavily using alcohol, they may increase their risk of liver dysfunction. Patients using this medication who have ALS should be made aware that the rate of functional decline of ALS may increase with the use of a statin. Patients should be made aware not to use gemfibrozil with this medication. Hepatic or liver failure has occurred with the use of Fluvastatin, so patients should be made aware to stop using the medication if they were to experience jaundice. If somebody is using Fluvastatin and they're being inadequately treated for hypothyroidism, they may also put themselves at an increased risk of myopathy. Patients should be made aware that rhabdomyolysis has been reported with the use of Fluvastatin, and a patient may be at an increased risk of experiencing this if they are also using fibrates. A patient may also be at an increased risk of experiencing rhabdomyolysis if they had renal or kidney impairment. Elevations in serum transaminase levels above 3 times the upper limit of normal has been reported with the use of Fluvastatin, and this may be dose-related. Now, once somebody has cleared the contraindications and is made aware of the precautions and warnings, and they start to use Fluvastatin, they can expect to receive their dose orally. So if somebody is using the immediate release formulation and their goal is to reduce their LDL by 25% or greater, they would typically use 40 milligrams once or twice daily. If their goal was to reduce their LDL by less than 25%, they would typically use 20 milligrams once daily in the evening. If somebody was using the extended release formulation of Fluvastatin and their goal was to decrease their LDL by 25% or greater, they would typically use 80 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Fluvastatin, so we'll go over some of those here now. 4 to 8% of patients may experience indigestion, and 2.5 to 3% may experience nausea. 5 to 9% of patients may experience a headache. Now, some more rare but serious side effects would be rhabdomyolysis, the rupture of a tendon, pancreatitis, or liver failure. That's all we're going to talk about today with Fluvastatin or Lescol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. And for today, take care.